So the benefits are obvious: smaller breasts, better shape, better size, less neck pain, less back pain. The trade off is the scar. The scar might be a little bit visible. Doctor, I'm thinking of getting breast reduction done. What is the best age to do it? Am I in the right age to do it? You might be having these questions, and let us talk about it. I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin ENT and Plastic Surgery. Now, let us start with the brief idea of what is breast reduction. A breast reduction surgery is done in women who have very large breasts to make them smaller and a better shape. Why is this done? There are a variety of reasons. One is very large breast, the physical weight of it can cause neck pain, shoulder pain, back pain. So medically speaking, this can give a huge relief to these women. Apart from that, there are various social factors. Women may feel embarrassed, they might not be able to get proper size clothing, they might not be able to get bras that fit them. All these are other issues. For all these reasons, women undergo breast reduction. Now, how is this done? You can see in this image a brief overview of how the surgery is done. Basically, in a large breast, we move the nipple up, we remove extra tissue and we close it. So there is a scar around the nipple and then there is a vertical scar below the nipple. You can see our other videos for a more detailed explanation and understanding of how exactly a breast reduction surgery happens. This is a fairly simple, straightforward surgery. It's done under general anesthetic with one night admission. And people are pretty much back to normal within a week. Now, as a doctor, this is one of the most gratifying procedures for me to do because the women are almost always very, very happy. They feel very liberated. They're able to wear better clothing. They're able to go out more confidently. They don't have neck pain and back pain. But having said that, there are some common questions that come up. One of the most common ones is, what is the right age to do it? Particularly among young women who might not be married yet, they might ask, is this okay for me to do now? Will it affect things in the future? So let us talk about it. So firstly, the biggest question of the benefits. It all depends on how much neck pain, back pain you are suffering from. If it is severe, then relief from that is always a good thing. So if that is something that is very severe, then doing it at any age is not a problem. Second question that is commonly asked is, will this affect breastfeeding? If I'm going to have kids in the future, will it affect that? The answer here is a little complicated because of 2 points. Firstly, we are technically not removing all the breast tissue. We're leaving a good amount of breast tissue, and that amount of breast tissue is enough to breastfeed. However, very large breasted women sometimes naturally are not able to produce enough breast milk. And we might not know if you are in this category or not, if the woman has not had children yet. So the bottom line is, you might not be able to produce enough breast milk, but it is not because of the surgery. That is because of your underlying state. So that's why the answer is a little bit complicated. The surgery itself is leaving enough tissue for you to produce breast milk. Thirdly, what about the scars? Will that be permanent? As I said, there is one scar around the nipple that fades with time and is hardly noticeable. There is one vertical scar below the nipple. That is what is noticeable. Now that also does fade with time. It becomes less and less, but it's not going to go away completely. And that is going to leave a slight mark. And this is something to be considered. Fourth point is, if after breastfeeding, will I lose some of the result? Will my breast sag again? Well, all women's breasts become bigger during pregnancy because of hormones and during breastfeeding. And yes, after breastfeeding, a little bit of sagging happens. But in very large breasted women, it's unlikely to come back to what it was. So what's the underlying answer? Well, there is no specific clear-cut answer. It depends on the patient. It all depends on how much you are suffering and how badly you want this procedure. So the benefits are obvious: smaller breasts, better shape, better size, less neck pain, less back pain. The trade-off is the scar. The scar might be a little bit visible. Now, for some women, this might not be okay. They might consider doing the surgery after marriage and having children. But for other women who are suffering a lot, they might want to do it immediately. So at the end of the day, like everything in plastic surgery, it's a personal choice. There is no right and wrong answer. It's all about what is right and wrong for you. All I can say is that in all my patients of breast reduction after the surgery, they are always very, very happy that they've gotten it done. They say it's literally a load off their head and neck. Now, let us see some results of breast reduction that will help you understand how the results look like and what the scarring will look like. I hope this video was informative for you. If you have any questions, do get in touch with us. Do like, share, and subscribe. Thank you. Have a great day.